Degenerative aortic stenosis is a disease of old age. Basically, it is disease of the aortic valve in which calcium gets deposited and the aortic valve is narrowed. So what is the aortic valve? It's the gatekeeper between the heart and the pipe that takes blood throughout your body. So when it gets narrowed, obviously the heart arteries that we call as coronary arteries don't get enough blood, as a result of which the patient will experience some chest pain. The blood to the brain is not so good. Also, there can be calcium deposition near the conduction tissue, due to which the patient can feel giddiness. And also, since there can be heart failure or there can be backflow of the blood into the lungs pipe, so the patient can also have breathlessness. In a short form, chest pain, breathlessness and giddiness are the major symptoms of severe aortic stenosis. How is this aortic stenosis diagnosed? Basically, when the patient has symptoms, he visits a doctor or cardiologist, and the cardiologist examines him. He hears a murmur by stethoscope and then sends for echocardiography. Severe aortic stenosis is diagnosed by echocardiography. Now, that's the basic point of diagnosis. After that, the patient comes to the doctor, and then the doctor evaluates for the risk of the patient, as traditionally surgical aortic valve replacement has been the choice of procedure for these patients. Now, if the patient is above 75, today, as per European guidelines, the patient directly can go for transcatheter aortic valve replacement. In a patient who is 65 to 75, you sit down with the patient. Both surgical as well as the transcatheter procedure option is given to the patient. The patient risk profile is monitored, and depending upon that, the treatment is decided. Now, I have told you that severe aortic stenosis can be treated by surgical method as well as transcatheter method. So the transcatheter method is called as TAVI or TAVR. Full form is transcatheter aortic valve implantation or replacement. What is the major difference in this? In a surgical aortic valve, the chest is opened, the patient is put on bypass machine, the native valve, that is the patient valve, is removed and an artificial valve is placed by the surgeon over there. Then the patient comes out of bypass machine, the ventilator, and the chest is closed. Now, in TAVI, the patient comes to the hospital, gets evaluated by CT scan. Depending upon the CT scan, his valve size is determined and the type of prosthetic valve is determined. The patient is admitted. Next day, the patient is taken into the cath lab. There, the patient is not put on ventilator. He does not require bypass machine. The chest is not opened. Through the legs, we go ahead, replace the valve. After we replacing the valve, we send the patient to ICU for a single day. The next day, the patient is usually shifted to the room. And on the third day, usually the patient is discharged. Now, there are 5 to 8% of patients in whom the conduction system may get disturbed, and these patients may require a permanent pacemaker placement. In that case, the hospital stay can increase by 2 or 3 days. After the procedure, the patient can go back to a normal life, to their daily life. There is no restriction, major restriction of anything. The major advantage is this is a minimally invasive procedure and has a fast recovery. So, if any of you have breathlessness, severe chest pain, giddiness, and is above 60 years of age, please reach out to a healthcare professional. This can be severe aortic stenosis. A severe aortic stenosis has a mortality of 50% in 2 years. But when treated, the patient can go up to 10 to 15 years without any difficulty, even more than that. So this is a disease which is more dangerous than cancer but has a definite treatment.